Broadcasting live from the Business Radio X studios in Atlanta, Georgia. It's time for Veterans Business Radio, brought to you by ATL Vets, providing the tools and support that help veteran-owned businesses thrive. For more information, go to atlvets.org. Now, here's your host.
Lee Kantor here, another episode of Veterans Business Radio, and this is going to be a good one. But before we get started, it's important to recognize our sponsor, ATL Vets, inspiring veterans to build their foundation of success and empowering them to become the backbone of society after the uniform. For more information, go to atlvets.org. Today on this show, this is going to be a great show. We have with us the founder of Questions for Cancer Doctor, Dr. Camille Williams. Welcome.
Hi, Lee. Thank you so much for having me. Pleasure to be here.
Well, I'm so excited to learn what you're up to. Tell us about Questions for Cancer Doctor. How did that come about?
Thank you for asking that question. I didn't start my Army career as a physician or even as an officer. Right. So I started as an enlisted 54 Bravo, which back then was nuclear, biological, and chemical specialist. And I trained at Fort McClellan as a 54 Bravo. I personally witnessed and worked in environments where chemical agents and decontamination training were routine back then. Right. So that experience gives me a very real understanding of how exposures can occur. Not hypothetical per se, but operationally. So the surrounding Anniston community at Fort McClellan, they have documented environment contamination issues that have been publicly acknowledged over the years, but many soldiers who lived off base or interacted within the community, they have not been acknowledged for any sorts of issues they may have. So when we talk about long-term health effects, we're not speaking in theory. I'm speaking about environments where toxin exposure has been formally recognized at Fort McClellan and the surrounding area. So at the time, we were just young soldiers doing our jobs. We trusted the system. We followed orders. We didn't question long-term exposure risk. So before medicine, I majored in biochemistry. So this is how I got into, I'm currently a radiation oncologist, right? And that's like the leading step into how I became aware of toxin exposure. So when a veteran from Fort McClellan comes to me with a cancer diagnosis, I'm not just reading a file. I understand both the on-base training exposure and the broader environmental context of the region. So this is a personal thing for me as well. It's not just textbook when it comes to the exposure these soldiers have had. I was there. I experienced that.
So now, are soldiers around the country, around the world that are around these kind of toxins, are they all kind of at risk, or was this unique to where you were?
No, they are, wherever they are, once they're exposed, they're at risk. The issue is that the PACT Act recognizes certain location and they recognize certain assignment. So if you are in Vietnam and you got exposed to Agent Orange, that is recognized as a presumptive diagnosis if you are diagnosed with, let's say, prostate cancer. But there's still other bases and other areas that are being found to have these exposures, but then they are not on that PACT Act list, and they're not given the benefit of the doubt, if you will, regarding their cancer diagnosis or any other diagnosis. It's not just cancer that these toxins can cause. There are many other types of issues that these toxin exposures can cause. So it's a matter of finding out what the diagnosis, that the condition that the veteran has, where they were stationed, what possible toxin they were exposed to, and then making the connection or the nexus, if you will. And that's what we do at Q4CD.
So any veteran that has any type of medical diagnosis, if they kind of connect with you, you can see if there's any type of recourse or maybe a connection of dots that maybe they weren't aware of?
Absolutely. Typically, my majority of my referrals comes from the VSO or other VA credentialed personnel, but I've also have some of the other veterans self-refer because they're not quite sure. So all of the veterans that I see, I don't automatically just go straight to doing a Nexus. I do an evaluation first to see if something truly exists. So we'll talk about where they were located, what their MOS or their job was. What does the VA says, or is it covered by the PACT Act or not? Are they within that time frame? And so not everyone needs a Nexus letter, and that's where the initial consultation comes in hand, where I help the veteran hand in hand go over the medical information to see if something exists. If something does not exist, I will let them know. I cannot make the connection with all of my background, being radiation oncology, biochemistry. I cannot see how this can be made. And I would refer them to say, go back to your VSO and see if there is something else or another physician or another specialty that you can consider to evaluate your current condition.
Can you explain for the listener what exactly is a Nexus letter and how does it, where does it come into play when in terms of their VA disability claim?
Sure. So a Nexus letter is a medical opinion that connects a veteran's current diagnosis to their military service, right? And so there are some instances where the connection cannot be made. So the Nexus is it just simply means a link. So we're answering the question, is it at least as likely as not that this condition was caused by or aggravated by the military service? So the VA requires medical evidence, not just a diagnosis, right? They need a connection. So there are people who have prostate cancer or breast cancer, and that's not connected to any exposure. It's not connected to their any of their assignment. So that's where the evaluation and using my knowledge of military as well as medical jargon comes into discussing what a strong Nexus letter is and what the medical reasoning is behind making that connection. So again, that Nexus letter is just a medical opinion that says this was caused by the soldier's exposure at a certain time during their service, during their time when they were in the military.
Now, is there any advantage of having an oncology Nexus letter rather than just a general Nexus letter?
Yes. So it makes a difference, right? So when you have an oncology Nexus letter, you are speaking to someone who has the expertise in cancer biology and the treatment. The clear statement used as far as leads as likely not gives you that probability. So if someone who is a general practitioner or someone who is not within the oncology world, they may not understand certain link or the radiobiology. For example, I'm a radiation oncologist. So I've worked with radiation when I was enlisted. I've worked with radiation, using radiation to treat cancer. I've studied radiation at the Armed Forces Radiobiology Research Institute. So I know regarding what exposure, what dosage exposure, and what time frame it would take, and what are some of the common cancers that can be caused by radiation exposure. So if someone was diagnosed with Hodgkin's, let's say when they were in their 20s and enlisted and they had radiation to the chest area, and then they have breast cancer when they're in their 40s or 50s, was that breast cancer normal or was it caused by the radiation treatment they had for their lymphoma when they were enlisted? That's where a specialist in oncology can really make that link and that causation, showing that the latency periods and the scientific literature which the VA is looking for explains logical medical sound reasoning about how this can connect to the current veteran condition. So it makes a difference in so I would not do orthopedic stuff. Like I wouldn't do joints. And if you have low back pain or if you have sleep apnea, you would need to go to like a pulmonologist. So the specialists are there for a reason, and getting a specialist Nexus letter stands very strong. No guarantees are made, but we're better able and suitable to explain radiation biology or the toxin biology when it comes to making that Nexus connection.
And I'm sure because of your unique expertise in this area, especially like a cancer diagnosis, you're able probably in a shorter period of time to connect dots or not connect dots. It wouldn't take you as long. Maybe things are more obvious to you than it would be for somebody who doesn't have your unique background.
Absolutely. And so also because I was enlisted and I have seen veterans come to me with their medical records that they have kept over the years. And now we're, more fancy and everything is electronic. But when we were moving from base to base, we would literally carry our packet with our medical information in there. And even looking at mine from the 1990s, some of those scribbles and what the doctors were writing was so difficult to understand. But now, as a physician, I can understand what was being written in my records when I was a private back at Fort McClellan and when I went in to see the doctor. So it gives me that connection not only from the medical perspectives, but also from the military perspective, looking at those old folder, knowing what the reference means, when you say PT, or if someone was put on a profile, what does a permanent profile mean or temporary profile? If someone was not in the military, that would not mean anything to them. So having the enlisted as well as the officer military background helped me better to communicate with the veterans in getting through some of these jargons even more quickly and efficiently so that they will know if there's room for Nexus or not.
And isn't this an area where you shouldn't be doing this alone? You can't just go on AI or you just can't Google something and try to figure this out on your own. You need kind of to have a Sherpa, an expert like yourself, to kind of at least give you some of the where you don't know what you don't know. And somebody like you knows a lot more than just a veteran that is going through something difficult, but thinks, oh, I can just power through and do this myself.
Absolutely. That is indeed correct. So when I do have the opportunity to speak with the VSO or any of the VFW or anyone who are credentialed to work with veterans, I acknowledge we're in a time when AI is just being used a lot and the trajectory is just phenomenal, right? It's being used more and more, and it's been found more and more in the clinics as well. But what AI does is that it can summarize information, but it cannot examine the patient. It cannot independently review original records with medical judgment or even reviewing the jargons, like I said previously, about profiles and injuries, etc. And it cannot ethically sign a legal medical opinion. So a Nexus letter requires physician accountability and licensure. Cannot get that from an AI. It requires clinical reasoning, oncology expertise, and professional liability. So AI is a tool. It's not a substitute for an independent medical opinion, especially as it pertains to toxin exposure and assignment and the likes.
So now when a veteran is kind of trying to get the care that they need, if they're fighting for this, are they going to an attorney first and then to a doctor? Are they going to a doctor first, then an attorney? Like what is kind of the order of operations here if you're trying to kind of get the care that you're fighting for, the care that you need?
Yeah. So because I'm sort of, think about relay, I'm sort of the third leg, if you will, right? So if a veteran is trying to fight for a diagnosis, regardless of what the condition may be, there are credentialed VA assistance that is available. So it really depends on where the veteran is in the process. Initially, as they're going through the process, the VSO or the VFW, the credentialed persons, should be there to guide them through it. I don't recommend that they just seek a Nexus letter on their own without knowing where it actually fits. So if they are denied, an attorney can help with the appeal strategy, but even attorneys often need a strong medical opinion to win a case, right? So a solid medical review early can prevent unnecessary delays as well. So my role is medical. I do not practice law. Ideally, the medical evidence and legal strategies work together. So because I'm on the outskirts, I'm not aware of all of the steps that's been going on with the claim and the filing. I highly recommend that each veteran, as they're going through their case, have a sit-down conversation, and now they know what a Nexus letter is, to ask, would a Nexus letter help me in this process? The law portion of it, as an attorney, they have their role as well, but I don't think I'm qualified to say at what point an attorney is required. I will defer that portion to their VSO or their credentialed VA person that they're working with. But I'm here. I will take referrals. They can find information on q4cd.com, and I'll be more than happy to let them know what I can or cannot do based on the consultation. But as far as where each falls, I would recommend, save yourself a few dollars, talk to the VSO. If you're not happy with the VSO, there are multiple, right? So if you want to reach to me and have a consultation, then I'm happy to go through that with you. But know that I do not file claims. I am not a lawyer. I will strictly be reviewing the medical aspects of things and then likely refer you back to your VSO for any sort of claim filing or anything that needs to be done from a credentialed VA specialist.
So in your opinion, the order of things is VSO and then you?
Yeah, I think you have to get your stuff together first, because I don't put the stuff together. I've had veterans come to me who have not seen VSOs or try to see a VSO, but they're very booked and don't think that they can get in time, and just have questions to wanting to know if it's best to do a Nexus letter before or a Nexus letter after denial. Sometimes they just try to make sure their packet is right the first time around. So I am happy to see anyone who would like to discuss if a Nexus exists based on toxin exposure. But I'm just a believer, because even when I was leaving the military myself, when I was retiring as a lieutenant colonel, I too went through the process. I too went and speak with a VSO, but as you can imagine, my encounters were much shorter because I have a very good knowledge of the whole medical process, etc. But I did respect the process, and I did speak to someone, and I was able to get through. But I've seen, I would say about 40% of the folks I speak with have not yet seen a VSO, but they do need someone to help them in most cases to file their claim and go through that process. So I'm happy to discuss anything medical with any veteran at any time.
Right, but in the first, so if you are a veteran and you have a cancer diagnosis, it's okay for you to be the first call, or is it better to have the VSO be the first call and then go to you after you've kind of established that relationship with the VSO?
I think the VSO should be the first call, right? Because there's a cost to speak with me, and seeing the VSO doesn't cost anything. And so I think talking to the VSO, if they're able to get through one, that should be their first step. That's what's recommended. And for those who are retiring or not yet retired, still on active duty, as they're in the process of leaving, they have more access to speaking to those who represent that transition. But I always think it's just reasonable, right? Because if I say, oh, come to me first, I think it'll be overwhelming for us. for so many folks to come to us, and they may not need us. But if you do have a cancer diagnosis, make sure you establish with the VSO. Usually doesn't cost anything. And if you feel that, okay, I've done what Dr. Williams asked me to do, I'm going to go to q4cd.com and I'm going to make a consultation appointment and then do both in tandem, that is also okay.
And then you mentioned the website. On the website, there's a lot of information that might be useful prior to going to that VSO meeting, right? Like that, your website has a lot of information on it.
Yeah, so on the website is q4cd.com. So it's Quebec for Charlie Delta.com. And the first box at the top has to do with getting information for Nexus letter. And there's also information there for prostate cancer and breast cancer. Those are the three things that I cover mostly in the Questions for Cancer Doctor website. But when you click on the q4cd.com and you go to the first link for Nexus letters, there is information there and also a list of some of the more common diagnoses that are covered. So if that page is accessed, it will show you the cancers and tumors that are covered, the blood and lymphatic cancers, some exposure-related issues. So one of the things that came to me recently had to do with Parkinson's disease. And I had to take a pause myself, like, Parkinson's? Okay, with toxin exposure? So I went and I did my homework to say, well, okay, is there a nexus for Parkinson's? What else is there that some of these agents, what are some of the conditions that some of these agents can cause, like the burn pits and the asbestos? So it may not be lung cancer from the asbestos, but you may have developed other issue. If it's not in the lane of cancer, an issue I can't do, or some breathing issue, then I'd recommend, hey, you probably need to see a pulmonologist, a doctor who specializes in lung conditions, to write that Nexus letter for you. However, if there's a direct link having to do with exposure and I can make that nexus, then yes, I'll be able to write that Nexus letter based on your exposure. So there is a link. Also, there are mental health conditions that can be secondary to cancer as well, right? Not only the expected like neuropathy from chemotherapy or brain fog from that, but there can be some PTSD triggered or worsened by cancer diagnosis or treatment, anxiety or depression. So while I do not cover anything that's more on the psychological portion or the mental health issue, if there's a nexus connecting it to your diagnosis of cancer and the treatments that you've gone through, I can assist with that area. So because I have such a niche and because there's so many veterans that have been coming my way, I try to make sure that I do my colleagues justice, right? So I will refer out if they need to go to someone else or refer them back to their VSO or have a conversation with the VSO if this is something that I think I can reasonably cover before the consultation. So it's really big on communication, and there's a list. You'll see a little tab there that says the list of diagnosis covers when you go to the Nexus page for q4cd.com, and you'll be able to see, well, can I reasonably go to Dr. Williams to discuss my case and if I can have a chance to do a connection between my service and my current diagnosis.
Now, do they have to be physically near you to get a relationship with you, or is this something that if they're anywhere, they can reach out and you'll be able to help them?
Oh, it doesn't matter where they are. Everything is virtual. Thank goodness for that. So if they want to schedule an appointment with me, there will be the link to go ahead and schedule the appointments with me. Doesn't matter where you are located. For Nexus letter, it's not as restrictive. However, if it's more to do with a DBQ, a disability benefit questionnaire, then in some states, you have to have certain license. So I have a license in Georgia, North Carolina, Illinois, Maryland, and Maryland also covered DC. So for those areas, I can review and do the disability benefit questionnaire with the veteran, but I cannot do the DBQ for everyone. So yes, Nexus letter, doesn't matter where you are. It's just doing my research and writing you a very well thought out and VA structured Nexus letter and reviewing it with you. DBQ, there's some limitations there.
Well, Dr. Williams, thank you so much for sharing your story. You're doing such important work, and we appreciate you.
Thank you so much for having me. Greatly appreciate your time.
And then the website one more time is the letter Q, the number 4cd.com. Dr. Queen Williams, MD, oncology specialist. Thank you again for sharing your story.
Thanks again for having me.
All right, this is Lee Kantor. We'll see you all next time on Veterans Business Radio.